months, we've had a big rethink, and we've changed our name to Everyone. The reasoning behind the name is that we want to support everyone, but it's about every one person, every one counts, so it's about the individual. So in a nutshell, Everyone is a Lincolnshire-based charity that works inclusively with everyone to ensure that every one carer and the people that they care for are at the centre of their own well-being. So we're very much about person-centred approaches, and we do that by delivering a range of services and projects that aim to make well-being personal. So just very quickly, the things that we believe as an organisation, people should be at the centre of their well-being, and they should be in control and have choice. And that can be choices to make bad decisions as well, not just good decisions. I use the example of my mum. Poor thing, she gets bandied around at anything that I talk to people about. But my mum's 86, she has dementia, and my dad's her main carer. And whenever my mum goes into hospital, she has a good old gets nagged at for smoking. She's 86, she's been smoking since she's 13, she's pickled in nicotine, and that's her choice, it's what's holding her together, but it's her choice. Not necessarily a good choice, but it's her choice. So we believe that people should have the option to have those choices as well. Services should be built around the person and not the process. How often do we hear computer says no, that it doesn't fit, and we think very much that one size fits no one, and it should be about supporting individuals. But many people, whilst they have the right to choice and control, they sometimes need support to exercise that choice and control, and we need to help people to get to the front door of things. And that people are the experts in their own lives, and that sharing lived experience can improve services. I was talking to somebody earlier about how we want to work with our volunteers, and our relationship with our volunteers I want to change to become more around sitting down with a blank sheet of paper with our volunteers and growing ideas and support from that. So that's really important to us. And where possible, we believe people are best supported within the community that they live, and in a way that recognises the whole person, and that individual, that person, that carer or the person they care for sits within the context of their family, their community, their support and services, and it all needs to be looked at together, not just at the individual. So we run a range of projects and services, just very briefly. We're involved in leading on the People's Partnership, which is a collective of partners who support on consultation across the county. We lead on Oasis, which is a volunteer-led telephone support service for carers of people with substance misuse. We're looking at setting up with a group of parent carers a new group in Lincoln, which is for young adults with additional needs and their parents to come together through musical theatre and drama. And we're looking for funding to get that off the ground as well at the moment. So I'll talk about a couple of the other projects later on. So I've done the plug. So facts and figures, employment and carers. So facts and figures, I'm not good with numbers, so I have to have them written down. So in the UK there's over 3 million working carers, and 1 in 9 of the workforce are juggling caring and paid employment. And every year over 2 million people become carers, and that can be either gradual or overnight. I think for me that's very important because I know somebody who went to sleep, not a carer, she woke up the next day a carer due to something that happened. So it can happen very slowly for people like my dad. My mum gradually has gone into dementia, and he's gradually become more and more of a carer, taking over everything from the daily cleaning, shopping, everything, and that's very difficult for him. So a number of carers over the next 30 years set to rise from 6 million to 9 million. 90% of working carers are aged 30 years plus, and that's prime employment years. And that's where I think this sort of discussion around employment is really critical, because it's really important for businesses to understand the benefits to them if they're working with their prime employees at that sort of area. 70% of carers have used their annual leave to care. Your holiday, your annual leave, should be there for you to have a rest, not to do more work. So how can we support with that? 48% of carers have done overtime to make up the hours that they've spent caring. And 49% of carers have given up work to care. And we'll talk later on some slides around how you might want to think differently before just stopping working. And 23% have reduced their working hours. I'm going to skip that one because I put that on there. It made sense when I did it. It doesn't make sense now. So, what carers tell us. This has gone from a national information that's come through about what carers are telling us generally about employment. So, many leave work when they feel they can no longer cope. They just stop. They leave work and they continue with their caring. Many more reduce their hours and turn down promotion and take lower paid work to fit around caring. And there's somebody at the session that we ran on Monday that talked about, she was in work, everything was fine, she was coping with that, but she felt that she couldn't progress because of her caring role. It was just stopping her going any further up in the organisation. And holiday leave available is not sufficient for people to be able to manage their caring and work at the same time. And as we heard earlier, people are using their holiday to continue to care. And many are unable to negotiate suitable working hours, and that flexibility within the employer and talk about that and have that conversation is important. And carers say that the help carers say they need is around more support from carers, care workers, support with household chores, and support managing or coordinating care. And that all feeds into their ability to have the time to go and work. And carers that leave work want to stay in contact. So even if a carer does leave work, either temporarily or permanently, they do want to stay in contact with their employer or with their colleagues. So as I said earlier, it's important for employers to understand the benefits of how if they support carers, it's good, better business for them as well. It can help reduce stress in the workplace. Generally, if you've got a carer who's tired, exhausted, juggling lots and lots of different things, with a bit of support from the employer, it can help to reduce stress, and that can have a much wider impact. Employees are one of your biggest costs as an employer and one of your biggest assets. And if you can reduce the turnover, the cost of recruitment, induction, training is really big. So if you can reduce that by supporting carers in the workplace, you're more likely to cut down on those costs associated with that. It can increase general resilience and productivity of your organisation, and it can improve staff morale, not just for those carers that might feel more supported in your business, but also from their colleagues who are witnessing how those people are being supported by that organisation. And that general morale can spread, it can be very viral. So if people are supported, it's going to impact generally. It can improve your service delivery. If you've got somebody that's less tired at their desk because they're being supported, then general delivery can improve. And that can attract staff and retain staff. The way businesses support their employees says a lot about that business, and that can make it very attractive to other employers. And that sort of image and culture does get out. It can improve people management. If you are a manager and you know more about your employees and their caring role, you're probably going to understand more about your employee generally, and your general management skills and support can improve. It can increase your competitive edge. All those things around how you work with your staff, how you improve your resilience as an organisation, your turnover, it can just give you that edge over another organisation that maybe doesn't. It can reduce sick leave, and there's costs attached to sick leave. It can, at the end of the day, it can help you with the law, complying with the law, and there's risks attached to not complying with the law. It can produce cost savings, as discussed, and just generally your brand reputation and your corporate social responsibility. It can just say a lot about you as an employer if you're supporting employees. So carers do have rights as employees. There's legislation that dictates that carers do have rights. And that's, as I say, I'm not a HR specialist, but there are rights, and we'd advise you to go and find out more about that. And that's a right to request flexible working, the right to time off, a right to time off in emergencies, and parental leave, shared parental leave, and protection from discrimination. And whilst there is law that encapsulates how carers should be supported, for me it's not just about the hard law and the must and must nots. It's also about that relationship and having that positive working relationship between the employer and the employee to do some of the softer things as well. So some advice to carers in employment. One thing I say is tell your employer, but it is your choice whether you tell your employer. There is a project which I'll talk about in a bit, which is about supporting carers in employment. And one of the things that we're finding through that is that we're supporting carers and employment. And we say, right, we'll go with you to your employer and have a chat with them about how you might want flexible working. But carers don't want us to talk to their employers. They don't want to disclose it to their employer. Whether that's about fear of discrimination, whether it's about not wanting to rock the boat, whether it's just about embarrassment, I'm not sure, but carers don't necessarily want to tell their employer about their circumstances. But we say if it feels right and you're possible, talk to your employer. Find a colleague to talk to. The chances are, statistically, the number of people nationally who are carers, the chances are someone you work with is also a carer in one way, shape or form. So find somebody else to talk to. Think about joining with other people in your organisation and setting up a peer support group. And that could be a peer support group that meets in your lunch hour, or it could meet down the pub after work, whatever. Or it could be a Facebook social media type of support group. But find others that are in a similar boat, and that might give you some ideas and tools and tactics on how to think about how you talk to your employer, engage with them. Find, read and understand your company policies and procedures. How many of us read our company policies on the day we walked into an organisation and have never looked at them since? You might have been at that organisation for many years,